Welcome to The Explainer. Okay, picture this. You've just started your shift and the call lights are already flashing like crazy. We've all been there, right? Today, we're going to build your essential toolkit for navigating these exact moments with confidence.
This is a question every single nurse faces, every single day. So how do you make the right call when every second counts? Well, that's what we're here for. Let's break down exactly how you can answer that question with total confidence.
So here's our game plan. We're going to tackle 4 core areas. We'll start with the basics, managing your own tasks, and then we'll build all the way up to leading a team when things get really intense.
Okay, let's dive right into our first crucial skill, prioritization. It really all boils down to one simple thing, deciding what matters most right now.
So, you can basically sort patient needs into 3 buckets. You've got your high priority stuff. These are the life-threatening needs, the things that could cause real harm if you don't act fast. Then you have intermediate and low priority needs, which are more non-emergency, non-life-threatening things. The key takeaway? Always tackle those high priority issues first.
So how do you spot those high priority needs in the wild? Well, your best friend here is the ABCs. It's your lifeline: airway, breathing, and circulation. And trust me, a problem with the airway, that is almost always going to be your #1 concern.
And before we move on, let's lock in this fundamental rule. It's so important. Before you can do anything, you have to assess the situation first. Seriously, this one simple principle underpins everything we do for safe and effective care.
All right, so we've got a handle on prioritization. But let's be real, you can't do it all by yourself, right? That's where our next skill comes into play, effective delegation.
So what are we actually talking about when we say delegation? It is not just about passing off tasks you don't want to do. It's a formal process where you're transferring the performance of a specific task to someone who is competent and has the authority to actually do it. And to make sure you're delegating safely and effectively, you have to follow the 5 rights. Think of this framework as your safety net. It's there to protect patient safety every single step of the way.
Now, this chart is super helpful because it breaks down who can do what. And knowing the scope of practice for everyone on your team, that's absolutely critical for safe delegation. For instance, you can see right here that the RN handles the big stuff like initial assessments and IV meds. You just can't delegate those tasks to an LPN or AP.
Okay, this is one of the most important things to remember about delegation, so listen up. You can delegate a task, but you can never delegate your accountability. That means even when someone else performs the task, the ultimate responsibility for that patient's outcome, it still rests with you, the RN. That's huge.
Okay, so we've gone from managing your own tasks to working with a team. Now let's level up again. We're moving from managing tasks to leading people. As you get more experience, your ability to influence others becomes just as important as your clinical skills. So let's explore what that actually looks like.
It's really important to understand the difference between being a leader and being a manager. They're not the same thing. Management is all about the what, accomplishing tasks, organizing things, but leadership, that's about the why and the who. It's that interpersonal process of influencing and inspiring people to achieve goals together. They're definitely different skill sets.
Now, there are a bunch of different ways to lead. You've got authoritarian, which is very top-down, democratic, which is all about group input, and laissez-faire, which is, well, pretty hands-off. But you know what the best leaders do? They adapt. They're flexible. They might blend a democratic style to get everyone's input with a transformational style to really build those relationships and get everyone excited about a shared mission.
And finally, let's talk about when all of these skills, prioritization, delegation, leadership, all come together in the ultimate test, emergency response. This is about your role when a true disaster strikes.
Okay, so imagine a situation where the number of casualties just completely overwhelms your resources. In that scenario, we have to switch gears and use a system called triage. It's basically a super fast assessment process, and the whole point is to do the most good for the most people possible.
First up, we have the red category, also called emergent. These are your highest priority patients, period. We're talking life-threatening injuries, think severe trauma, chest pain, that need immediate attention to survive.
Next is yellow or urgent. Now, these patients are seriously injured, maybe an open fracture or something like that, but it's not immediately life-threatening. The key is they can wait a little while for treatment, but not too long.
Then we have green, or non-urgent.
This is for more minor injuries, sprains, small lacerations. These are often called the walking wounded, and they can safely wait a bit longer for treatment.
And last is the black category. This is for victims who are either already deceased or their injuries are just so severe that they wouldn't be able to survive in a mass casualty situation. And, this is absolutely the hardest part of triage. No question.
And this right here really gets to the heart of disaster triage. It's a huge mental shift from your normal day-to-day nursing. The goal isn't to do everything possible for one patient anymore. It's about thinking survivability. It's about saving the most lives you possibly can with the limited resources you've got.
Wow, we have covered a lot of ground, haven't we? From prioritizing a single patient all the way to triaging dozens in a disaster. So as you move forward, I want you to think about this. Which of these skills do you think is going to be your biggest challenge? And where do you really want to focus on growing? Don't forget to like and share.